All right, we're back on the Morning Brew. We are live, by the way, here Monday morning in Albuquerque, and my name's Larry Ahrens. I'm your host here on the Morning Brew, along with our co-host Aaron Muffaletto, and it is a pleasure to welcome our very first guest this morning, Dr. Steve Tolber. Dr. Tolber is an allergist, and how many in the room have allergies here in New Mexico? That's a show of hands of everybody. And Dr. Tolber, welcome. Happy to have you here. Thank you for coming.
Thank you.
You're a very popular guy these days, aren't you? You have a lot of people coming to see you. Your practice is called Breathe America. Tell us a little bit about that, first of all.
Breathe America is a company out of Nashville, Tennessee, and there are several Breathe Americas throughout the United States at this point, and of course, I would foresee that there'll be many more.
And do you have okay, so I have allergies. So is there a fix-all for everybody, or do I have to come in and get a certain prescription for my certain allergies? How does that work?
Well, no, you know, each person has a different type of allergy. There are different grasses, weeds, trees. Occasionally, even in this area, people can be allergic to molds. There's food allergies. Mm-hmm. Some of the folks who come in have bee sting allergies and so forth. But for the most part, we try to do medical treatments for most of the people.
How do you test for, how do you know what you're allergic to? What's the first step you take when you're seeing a patient? They're sneezing, the eyes are watering, they don't feel good. How do you start the process?
Well, we try to put together the time of the year when the person is allergic to the most likely type of problem. So if you're sick during the spring and the fall, most likely it's grasses, weeds, and trees. And as you were saying, you know, we do skin tests, which we mainly put on the back. And we scratch the person with those. And if they come up big and red, you know, then...
You had that done?
Yeah, we were talking about that earlier, and I had it done. And I have bad allergies, as you might be able to tell with my sniffling this morning. And yeah, almost everything turned out red. Right now, around this season, what's like the number one thing that people are allergic to?
This time of year, it's the trees, and it's usually juniper, elm, and cottonwood are the primary trees that we see.
Oh.
I'm allergic to juniper. I just know it, and I've got juniper bushes all around the house, and I want to chop them all down this time of year. Is that the most common allergy in New Mexico right now?
Juniper clearly is the most common.
I mean, there's sometimes when that pollen is like a fog, you can see it, and there's just nothing you can do. You just have to.
It's really surprising in the wintertime if you tap a juniper tree, it'll fog up, like you said. It's.
You mentioned bee stings and bees and insects. It's kind of hard to know if you're allergic to a bee or a bee sting until it actually happens to you. Mm-hmm. Is this a common allergy among people? Do you see a lot of that?
We don't see a lot of it here. I know in the southeast we'd see an awful lot more. I was trained at Emory University, but in Atlanta. But we do see a small amount here actually. And people, when they do get stung, if they just have a local reaction, again, we don't do too much about that. But if they have lip swelling, tongue swelling, or airway problems, or drop in blood pressure, then we get more active. What we really see is a lot more of the, as you're saying, the pollen allergy. And I don't know that people realize that we're seeing really respiratory disorders. And that includes that the nose and the sinus and the chest really are one organ in a sense. So people who come in frequently have sinus problems as well as asthma.
So if I wanted to get something over the counter, or if there's something at home I can do to remedy my allergies, is there something you would recommend? Any at-home remedies?
Well, sure. You know, the over-the-counter medications include the antihistamines like Claritin and Zyrtec, which, you know, are really quite effective. I think we get involved more when people have tried to use those kinds of remedies and they're still having problems. So we can offer them nasal sprays as well.
Okay.
What's more effective, taking the over-the-counter pill or something that you might prescribe, or is a nasal spray or something like that more effective? What?
Some of the nasal sprays that you can get over the counter, the saltwater washes,
The salines. And...
they can be very effective. If you can wash the pollen out of your nose, then it doesn't activate the immune system. So once the pollen does hit the nose, then the white cells in your nose get kind of angry, as it were, and they create a problem. They cause leakage and swelling in the nose and runny nose and the whole business. And that message then gets transmitted throughout the system that we talked about, the sinuses and the chest. So treating the nose is really important.
Okay, take us through what's happening in your body when the pollen gets in your nose. I mean, what is it causing? Take us through the trigger that makes you feel bad. What's going on in there?
Primarily what's happening is there's an abnormal recognition of that pollen. The proteins in the pollen make the white cells react. And when that happens, the chemicals that are released cause swelling and itchy nose and sneezing and nasal congestion. And the white cells, as they travel throughout the body, can only land in two other organs, namely the sinuses, which get swollen. And you can get infection or polyps in the sinus. And once they land in the chest, many people will notice during the peak season they start having asthma as well.
Wow.
And that's where the allergy shots come in, because you can kind of retrain the white cells to kind of calm down.
And the allergy shots are kind of go in part with the prescription to find out what exactly you're allergic to.
Exactly.
So you can't just have a one-all allergy shot.
No, we try to tailor the injections to fit what your skin test showed.
Okay.
So those little red marks on your back tell us which of the grasses, weeds, and trees to add to your mix, so it's individual.
Yeah.
What about, I'm sorry, Aaron. What about animal allergies? How do you tell if you're allergic to your cat or your dog?
Pretty similar. If you get around your cat or your dog and you start having an itchy nose or sneezing, or you start getting tight in your chest, congested in your chest, or coughing, those are all symptoms that you're starting in. Actually, if your animal scratches you and you break out in a red rash, that's sort of like a cheap skin test.
Yeah.
If you think about it.
Yeah.
So I was thinking, a lot of people locally say that you should ingest local honey and that'll help your allergies. Have you heard anything about that? Do you recommend that?
I have heard about that, and some people actually claim that they're better. In Europe, they're actually taking pollen granules and putting them in your mouth or under your tongue and swallowing them. And it actually does work to decrease allergy, but it takes a lot longer and doesn't work as effectively as the injections. So there is a model that if you took pollen directly, you would get better. And how much pollen would be, or how much of the proteins would be, in the bee extracts and so forth, it's hard to say.
Can we talk about food allergies for a moment?
Sure, sure.
And you see people, I'm sure, that have these peculiar issues with peanuts, or I'm trying to think of what else.
I've had tuna.
Tuna. I used to think I was allergic to chocolate because every time I would eat chocolate, I'd get a sore throat. I don't have that anymore. But that's not uncommon to see these rather peculiar allergies pop up when people consume something.
Absolutely. We're seeing an awful lot more food allergies than we've ever seen in the past. I'm not sure that we have a good explanation why allergies are getting worse, but this is very, very common. One of the confusing things for me is that some of the folks come in and they'll have some heartburn and reflux where some of the contents of their stomach are coming back the wrong way. And when that happens, whether that causes a sore throat or other problems that come and go can be very difficult. The main thing with allergies, and the fellow who trained me years ago said allergies cause itchiness. So itchy nose, perhaps itchy throat, and then you have other symptoms along with that, swelling of the tongue, swelling of the lips. So,
can you grow out of them? I don't have that reaction to chocolate anymore. Does your body overcome that at times?
It can overcome that, and we've seen people who come and go with their allergies. And in fact, there's some new things that are coming along that are very surprising. some insects actually can carry chemicals or proteins that are very similar to foods. So we're now seeing people who are being stung or bitten by ticks, for example, and become allergic to meat in their, as they become older. So new allergies in adults used to be rare.
We have a little less than a minute. How can people reach your office at Breathe America and come in and see you for some advice?
Well, they can get on the website, breatheamerica.com. They can also call us at 883-2574.
Okay, I'm going to program that number into my phone right after this because I need some help with my allergies.
Dr. Tolber, thank you for being here today. We appreciate it, and you're invited back. We'd love to have you again.